Hello students, today we are going to see the anterior compartment of the forearm, which is also called as a flexor compartment of the forearm. From the elbow to the wrist, this region is also called as a antebrachium, and from the wrist to the tip of the finger, also called as a hand or the manus. So this is the superficial flexors of the forearm. The glistening structure is a flexor retinaculum. Some of the muscle inserted at the wrist or some of the in the digits. So let's see. Most medial, this is the left hand. So come to the most medial structure, that is a one oblique muscle. First oblique muscle is a pronator teres, that is a origin from the medial epicondyle of the humerus and coronary process and inserted at the lateral surface of the radius. It has the superficial and the deep fibers. Through this, median nerve passes through the superficial and the deep fibers. The second is a flexor carpi radialis muscle, which is originate from the medial epicondyle of the humerus and inserted at the second and third metacarpal bone, which helps in the abduction and the flexion at the wrist joint. The third one is a palmaris longus, which is vestigial muscle origin from the medial epicondyle of the humerus and inserted at the flexor retinaculum and palmaris aponeurosis, which protect or preserve the deep structures of the hand. The glistening structure you can see is a palmaris aponeurosis. The largest muscle in the flexors of the forearm is a Flexor Digitorum superficialis, which has the 4 tendons. Flexor Digitorum superficialis originate from the medial epicondyle and the medial border of the coronary process and anterior oblique line of the radius. It is at the wrist. It gives the 2 superficial and the 2 deep tendon. It divides into 2 superficial and the 2 deep tendon, and it passes underneath the flexor retinaculum, and in the hand it runs singly, and at the metacarpophalangeal it splits into 2 and inserted at the lateral aspect of the middle phalanx of the medial 5 digits. The flexor carpi ulnaris origin from the medial epicondyle of the humerus and the posterior aspect of the ulna inserted at the 5th metacarpal bone pisiform and the hook of the hamate. It helps in the adduction and flexion at the wrist joint. This is about the all 5 superficial flexors of the forearm. The superficial flexors are supplied by the median nerve except the flexor carpi ulnaris muscle, which is supplied by the ulnar nerve. Okay. Thank you so much for the listening. If you like the video, please subscribe and share it to your friends. Thank you so much.